Now we'll discuss the portal vein. How is it formed? It is formed with the help of superior mesenteric vein and splenic vein. Both of these unite to form the portal vein, which further divides into right and left branches, which will supply the right and left lobe of the liver. Now, how the superior mesenteric vein is formed? It receives all the same tributaries that were for the superior mesenteric artery. What were the tributaries? As you can see here, the tributaries were inferior pancreaticoduodenal artery, the middle colic, right colic, ileocolic, and some jejunal and ileal branches. So same are the tributaries received by the superior mesenteric vein. But one additional branch which will be received by superior mesenteric vein is the right gastroepiploic, which drains the greater curvature of stomach. So, inferior pancreaticoduodenal drains in superior mesenteric. Then, where the superior pancreaticoduodenal drains in the portal vein directly. Now, the splenic vein, how is it formed? Splenic vein is basically formed by the short gastric veins, as already we've discussed about the arteries. Same is here, from spleen here and short gastric, and now the left gastroepiploic from the greater curvature of stomach. And another additional branch which will now drain here is inferior mesenteric vein will drain into splenic vein. In arterial supply, it was a direct branch of aorta, but in portal vein, it will drain into the splenic vein. What were the tributaries for inferior mesenteric vein? These are, as you can see, for the artery, superior mesenteric artery gave the branches left colic, sigmoidal, superior rectal. Same is the case with the portal vein. It will receive all of the three branches, superior rectal and the sigmoidal left colic, and we will form in inferior mesenteric vein, which will drain to splenic vein. Splenic vein will combine with the superior mesenteric vein, and both now forms the portal vein behind the neck of pancreas. An important relation you must remember. Now, the right and left gastric branches directly drains into the portal vein, which drains the blood from the lesser curvature of stomach and esophageal vein. And the superior pancreatic renal we have already discussed, and a bile duct also drains into the portal vein. Now, for the stomach, the venous drainage we can see from the greater curvature. First, the short gastric and left gastroepiploic, right gastroepiploic. You can see the branches, they are respectively branches of splenic and superior mesenteric. From the lesser curvature, you can see left and right gastric, which are direct branches of portal vein, and the esophageal vein from esophagus. Now, the right and left branches, they divide in liver. In right and left branches, the right branch receives cystic vein. You remember that the proper hepatic artery in the arterial supply divided into right and left, and the right gives the cystic artery. So similar is the case with portal vein. The right branch will receive the cystic vein. The left branch will receive the branches from ligamentum venosum and paraumbilical veins. Paraumbilical vein also receive from the falciform ligament, and these all into left lobe of lung. So portal vein is important as it forms the cavo portal or portosystemic anastomosis. So this was all about the portal vein. If you have any question, you can ask.